December of 2014, in Ireland, a family was presented with an ethical tragedy. Doctors declared a 17-week pregnant woman clinically brain dead and recommended she be taken off of life support because the chances of the unborn child surviving were minimal. The family agreed, however, it was not as simple as that. The physician's recommendation and the family's wishes were overruled because of the Irish Protection of Life During Pregnancy Act. Section 22 of that act makes it an offense to intentionally destroy unborn human life. Section 23 makes it possible for hospitals to be persecuted under the act. Because of this, the hospital's lawyers stepped in to stop the discontinuation of life support. Despite the fact that the woman's doctors, her family, and the father of the fetus all agree that the woman's life support should be turned off, the constitutional protection for the life of the unborn trumped all of their wishes despite the family's pain. Brown stated, "Personal autonomy is usurped by a paternalistic state that has no qualms about denying women the right to bodily integrity." The family was forced to appeal to Ireland's High Court to stop treatment. It's the only country known in the democratic arena to ban abortion. The Eighth Amendment of their Constitution states that the life of a pregnant woman cannot be chosen over that of the fetus. Ireland's High Court ruled that doctors could switch off the life support. The court was satisfied in the circumstances of this case that to maintain and continue the present somatic support for the mother would deprive her of dignity and subject her family to unimaginable distress and a medically futile exercise. An Irish Health Service executive had stated that the Constitution was not designed to cope with cases where a brain-dead woman was kept alive because she was pregnant. I'm certain that the nurses caring for this woman were bearing a lot of emotional distress because of the issues of beneficence and non-maleficence, which states, first, do no harm, prevent harm, remove harm when it's being inflicted, also, always act in a way that will benefit others. On one hand, their duty to the woman was to provide her with dignity, especially since her care was medically futile. The Washington Post states, medically futile care does not prolong life, it prolongs death, which is just causing more harm or pain to the patient. On the other hand, they also had a duty to care for her baby. However, since the physicians feel the baby did not have a chance to survive, they must have also felt that they should provide the baby with the dignity to die peacefully, without undue pain and distress. Provision 1 of the ANA Code of Ethics states, the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes for every person. This case also went against Provision 1.4 of the Code, which supports the respect for human dignity and the right to self-determination, which is a legal and moral right for patients, which includes a surrogate decision maker when the patient lacks the capacity to make decisions for themselves, as this patient obviously did. The importance of carefully considered decisions regarding withdrawing life-sustaining therapies is widely recognized. Nurses assist patients and families with these decisions. Nurses promote advanced care planning and should be knowledgeable about the benefits of advanced directives. The nurse should provide interventions to relieve pain and other symptoms in the dying patient. This case is a prime example of organizational ethics over that of personal ethics. The hospital was concerned about the threat of legal action against itself and the doctors because of Section 23 under the Protection of Life During Pregnancy Act, which states that hospitals can be persecuted for intentionally destroying unborn human life. The National Hospital Organizations of Japan quoted the following regarding organizational ethics. Physicians, however, view discontinuing life-prolonging treatments negatively due to fear of police investigations. The conditions for futile life-prolonging treatments are those carried out for the sole purpose of prolonging life and are detrimental to the patient. Organizational ethics focuses on the larger societal and bureaucratic organization of modern healthcare. Therefore, their goals are not limited solely to the ethical goals of individual health professionals. There are also strong social implications for this case. It raises the question of whether a clinically brain-dead person should be considered alive in an irreversible coma or dead. It also raises the question of who should pay for such an individual, especially with the patient's family begging for the discontinuation of treatment. If the patient is deemed alive and in an irreversible coma, should the family be stuck paying for treatment that they are refusing? This hardly seems fair or right. Or should the Irish government, who is pushing for the continued life support, be the one to foot the bill? As a nurse caring for the clinically brain-dead patient, we must use the 6-step process for ethical decision-making to help us dictate our care. In step 1, we should collect as much information as possible about the case. We should hear the family side as well as the physicians. We should look into the mission statement of the hospital as well as policies and administrative practices in order to incorporate the organization's ethics. We should also look into the legal aspects of caring for this patient. All added information will bring us closer to reaching a caring response for this patient. In step 2, we will identify the ethical problem. We see we are in an ethical dilemma that is causing us moral distress. We know that there are 2 ethically correct courses of action: continuing life support to keep the fetus alive and terminating care to ensure the dignity of the woman. Step 3 includes using ethical theories to analyze the problem. We decide to approach the situation from a utilitarian standpoint, which Pertillo and Doherty state will guide us by the desire to bring about the best overall consequences in this situation. Step 4 dictates that we exercise our imagination and confer with our colleagues, the institution, the lawyers, and the family regarding the actual strategies and options available to us. The next step is to complete the action. Will we continue care or discontinue life-saving interventions? We know that in the real situation, the court decided to discontinue care and allow the patient to die gracefully. The final step is to evaluate the process and outcome. This involves discussing what we did well and why. What were the most challenging aspects of this situation? Who was the most helpful? What did we learn? All of this knowledge will serve us in preparation for the next opportunity to decide what a caring response entails for a future similar situation.